Hello, I'm Marie Zayas. I am a second year on the forensic track, and today I'm going to be presenting to you about sleep-wake disorders. So why is sleep important? There are a couple of theories why I'm going to go over, but interestingly enough, researchers are not entirely sure why humans need sleep, but I can tell you that a lack of sleep can ultimately lead to death within 2 to 3 weeks, and for this reason, extreme sleep deprivation studies on humans have not been conducted. However, there are a few theories as to why humans need sleep. The theory of inactivity is a caveman theory. This thought is that if humans were bedded down at night when there was little to no light, it would be safer than wandering around because of the dangerous nocturnal animals. The second theory in the caveman theory is the energy conservation, which postulates that after hunting, gathering, and eating, the body needed to rest in order to do the same activity the next day. As it is less efficient for humans to hunt and gather at night than in the daytime, we sleep at night. And then some modern theories. The restorative theory is about body restoration. At the cellular level, during non-REM sleep, the body releases human growth hormone, which I'll refer to as HGH throughout this presentation, which is crucial to muscle and tissue repair, as well as maintaining a hormone balance. Additionally, protein synthesis occurs in non-REM as the genes responsible for this process are more active. Sometimes the brain just needs a break too. So research suggests some type of sleep is a way for the brain to relax as neurons are less active. Even when neurons are grown in a lab, there are periods of activity and inactivity, or reduced inactivity rather. And additionally, during the periods of activity, the brain is producing waste. During sleep, the brain sweeps out toxic waste, which is referred to as pruning. Brain plasticity has to do with cognitive functions in particular, working memory, the ability to tend to information and regulate emotions. During sleep, consolidation occurs, which is the process of information being transferred from short-term to long-term memory. Researchers know during periods of life where a great deal of learning is taking place, like graduate school, more hours of sleep are needed. So now you know why sleep is important. We're going to define sleep and go over some common sleep disorders, symptoms and treatments, and assessments in practice. So what is sleep? It's broken up into 3 stages, and it consists of 2 psychological states: rapid eye movement, REM, and non-rapid eye movement, NREM or non-REM. Non-REM is comprised of 3 stages, and for those of you who might have learned a lot about sleep, they used to be composed of 4 stages, and now they've combined stage 3 and 4 into one. Stage 1 is when the lightest sleep occurs. Stage 2 is where you spend most of your time sleeping, and that might be the time where you have no recollection that you were even sleeping at all. Stage 3 and 4, which is now just stage 3, is the gamma sleep. This is where the deepest stage of sleep occurs and is most commonly referred to as deep sleep, delta sleep, or slow wave sleep, and it is associated with a high arousal threshold. So sleep occurs in 90-minute cycles, with most sleep in the first part of the night being stage 3-4, and most REM sleep occurring later in the night. Frequent wakenings can occur during these cycles, but typically they're so brief that you don't remember waking up for a prolonged period of time. It might be you wake up for 5 seconds and you fall right back asleep. A sleep-wake disorder prevents an individual from obtaining restful sleep and results in fatigue, daytime sleepiness, difficulty concentrating, memorization, and complaints are often made in regards to the amount of quality and quantity of sleep. If untreated, sleep disorders can increase the risk for development of obesity, diabetes, cardiovascular disease, depression, negatively affect chronic conditions, and can ultimately lead to death. In fact, after only 24 hours of no sleep, some research participants have experienced hallucinations and schizophrenic-like symptoms. A lack of sleep over a period of time can increase the chance of developing anxiety and depression, or worsen the symptoms of both. Developing a sleep disorder is not a common sign of aging, as some might actually think, but it does increase as the presence of medical and psychosocial problems become more common with age. So there are 11 diagnostic groups of sleep-wake disorders in the DSM, but these four down here at the bottom are the most common within the United States and will be the focus of the presentation. First is insomnia. It's the most common sleep disorder in the United States and is characterized by difficulty falling asleep and staying asleep. As far as we know, based off self-reports, women are more impacted by insomnia than males are, and the disorder can be acute or chronic. Acute insomnia lasts for a few days to weeks, whereas chronic is an ongoing condition impacting an individual for a month or more. Acute insomnia can be caused by medications that treat ADHD, corticosteroids, thyroid hormones, high blood pressure medication, and some contraceptives, as well as cold and flu medications that might contain alcohol and pain relievers such as Midol, Excedrin, or diuretic pills and slimming pills. It's also important to know that caffeine may be in these medications as well. Additionally, consuming alcohol or caffeine or sugar later on in the day or too close to bedtime can also impact the ability to fall asleep. Chronic insomnia is caused or influenced by anger, worry, grief, anxiety, stress, trauma, and depression, and bipolar disorder as well as brain injuries. The responsibility of sleep mainly falls on the anterior hypothalamus, and that's why it's in the middle. The sleep system can be compared to an on and off switch. The off switch is sleep is induced by GABAergic inhibitory neurons, such as serotonin, whereas the on switch is heavily influenced by cortisol levels, especially in the early part of the evening prior to sleep. The higher the cortisol level, the more active the HPA axis is. So ACTH is released because of CRF, which is corticotropin releasing factor, thus causing awakenings. So it's best to keep the cortisol level early on in the evening down. So things like having a fight with a partner or checking bills or maybe checking email should try to be avoided to keep cortisol levels down. So what should you know about insomnia? Episodes of insomnia are often the first sign of depression or the relapse of depressive episode, as it is a side effect of a neurological impairment that is absorbed in sleep regulation prior to a change in mood. In patients with bipolar disorder, sleep is also disturbed prior to and during manic episodes. And then the severity of PTSD and sleep quality also have a direct relationship. 80% of patients with PTSD report difficulty with sleep, and a study that was conducted in Korea found poor sleep following a traumatic event could predict the development of PTSD within 1 year. Mixed research exists to explain the neurobiological changes within PTSD that impact sleep, but one theory could be the hormonal stress that changes after exposure to a traumatic event or repeated exposure to traumatic events. Finally, sleep disturbances after concussion or a TBI are very common. 6 studies documented the relationship between injury and sleep disturbances and illustrated the less severe the injury, the more likely the patient was to notice and complain about sleep disturbances, as they are more aware of the deficits than somebody or a patient with a major brain injury. There are 3 reasons why sleep is significantly impacted following a brain injury. One, similar to depression, there's hormonal changes that occur shortly after the injury. 2, interventions after the injury create significant stress, thus changing the activity of certain hormones. And 3, the administration of corticosteroids after the injury can alter the secretion of HGH and prolactin, which can disturb sleep. The takeaway from the slide is to understand that insomnia, while common, chronic insomnia is not normal. It can be incredibly frustrating for anyone, but especially patients who suffer from a disorder or an injury. So identifying insomnia with your clients early on can really assist them in living a better and more full life and helping to alleviate some of their depression or anxiety symptoms. So sleep hygiene is the number one way to treat insomnia. And I'm going to provide a handout with some things that are important for sleep hygiene, such as using the bed only for places where intimacy occurs, sleep, or maybe if you're recovering from an illness. People who have a difficult time falling asleep at night or who wake up at 3 o'clock in the morning and spend those 2 hours awake saying to themselves, if I sleep now, I can sleep, X amount of hours before my alarm goes off. You should really get out of bed and try to do something in low light to try to fall back asleep. There's also some medications that can be used for acute insomnia, but not for chronic, and long-term use of sleep aids can make symptoms worse. And then, of course, there's cognitive behavioral therapy, which has been shown to be the most effective, and it includes using behavioral treatments, including sleep hygiene, and stimulus and or sleep restriction with cognitive restructuring. Non-medical interventions include things like herbs, which could be passion flower or chamomile tea, lavender, or using melatonin. Next, I'm going to go over sleep apnea. It affects roughly 20 million Americans, but as 80% of the population might have it and not realize it. There are two types of apneas. There's obstructive sleep apnea and central sleep apnea. Obstructive is caused by the airway collapse at the back of the throat during sleep, and air is unable to reach the lungs. Patients will often complain of frequent wakenings at night. And central apnea is when the brain fails to tell the body to breathe. When oxygen is not delivered throughout the body, it disrupts the sleep pattern, not allowing for restful sleep. So, apneas versus hypopneas. An apnea is a complete stop of respiration, whereas a hypopnea is a partial decrease in respiration. AHI is the method for measuring sleep apnea, and more than 5 AHIs an hour is considered apnea. Here are some common symptoms: frequent wakening, choking, snoring, difficulty regulating a mood, emotions, as well as hormonal changes, appetite changes. Diabetes is also more common in patients with sleep apnea than patients without the disorder, and there may be an association between apnea and insulin resistance, but more research is needed. Next, I'm going to briefly go over restless leg syndrome and narcolepsy. I'm not going to go over the treatment for sleep apnea, restless leg syndrome, or narcolepsy because they require medical interventions, and mainly the only thing that you can really do in therapy is going over sleep hygiene and cognitive restructuring of ruminating thoughts that your clients might be having. But what's important to know about restless leg syndrome, it's pretty rare. About 10% of adults have it and 2% of kids. And it's a neurological disorder where patients complain of an overwhelming feeling, typically to move their legs, but sometimes it can be other parts of their body. The exact pathophysiology of the syndrome is uncertain, but the spinal cord and peripheral nerves, as well as central dopamine and narcotic receptors, are thought to be involved. Narcolepsy is the least common sleep disorder in the U.S. Approximately 200,000 clients have it, and it's a neurological disorder that causes the brain, creates an inability in the brain to control sleep and wake cycles. Patients with narcolepsy often fall asleep during the day, even during active activities such as walking, driving, or having a conversation. And then they often complain of fragmented sleep at night, which is quite frustrating, as you can imagine. So again, I'm not going to go over how to treat these last three sleep disorders for the sake of time, and because outside of sleep hygiene and discussing the frustrations and providing empathy to your clients, there's not a lot that you can do. But the Insomnia Severity Index will be brought into the clinic in Hillsborough and Portland within the next couple weeks. So for sure, by the time you get to the clinic site, if you end up going that route. And the Insomnia Severity Sleep Index has just a couple questions, as you can see. And this part down here, the guideline for scoring interpretation, will not be included on the copy that the clients are provided and fill in, so that you can grade them when you're grading all of your assessments. And this can just be a way of identifying if your client has insomnia and helping you to treat it as well as to track it throughout therapy. So this concludes my presentation, and thank you so much.